Our wait times are among the lowest, the worst in the country.
A new report from the Canadian Institute for Health and Information puts Manitoba's surgical backlog into perspective, showing that through the first 18 months of the pandemic, some wait times have been among the worst in the country. Ophthalmologist Dr. Jennifer Rahman says cataract surgery came with a wait list even before the pandemic. In 2014, she says the benchmark of getting a surgery within 16 weeks was met 63% of the time. Now it's under 40.
The patients are experiencing wait times well above the national benchmark, and we need to really report how long they're waiting to get their first eye done, because that's really what's driving the backlog. That's the actual backlog.
The provincial government's median wait time for cataract surgery at Misericordia is 16 weeks, but Rahman says that's misleading, as that number is lowered when the much shorter wait times between first and second eye surgeries is added. Rahman says there is capacity to do around 9,300 surgeries a year, and right now that's equal to the current backlog. She's calling for the government to lift that cap to get back on track.
The ideal situation would be if they just allowed us to continue doing as many cases as possible and left us uncapped for cases at our public centers so that we could get the job done.
Manitoba was also second lowest nationwide in knee replacement surgeries over the first 18 months of the pandemic. Only 38% of Manitobans received knee replacement surgery within the 26-week medically recommended benchmark. The CIHI report did show some positives in Manitoba's handling of backlog during the pandemic. Manitoba was the only province to be able to maintain 100% of patients starting radiation therapy treatment within the medically recommended 4-week benchmark. We reached out to Health Minister Audrey Gordon for a comment, but did not hear back by broadcast deadline. Doctors Manitoba President Christian Thompson saying, as physicians, we know patients need certainty and hope about their wait times. We look forward to the government publishing more data on a regular basis and setting a date to clear the massive and growing backlog of surgeries and tests. Doctors Manitoba currently estimates that the total surgery backlog in Manitoba is approximately 170,000 procedures. In Winnipeg, Mike Albanese, City News.